Okay, this time I'm gonna help female patient who has a urine catheter. I'm gonna help her the catheter care. Okay, catheter care is very important to prevent the spreading of infection. Okay, knock knock. Curtain for the privacy. Hi, Mrs. Smith. How are you? My name is Eurina, your CNA. I'm going to help you clean your urine tubing. I'll be right back, okay, with the equipment. When you explain to the patient about the procedure, try to use, some simple words so that they can understand instead of the medical term. I'll be right back, Mrs. Smith. Okay. You will need the water basin. Run the water so then the water gets warm. You have 1 towel, maybe 2 towels, and 1 washcloth, soap, and the gloves. To check the water temperature, warm. I'll get it. And you have all your equipment and ready. Okay. Okay, Mrs. Smith. Just put the table on this side. Okay. I'm gonna wear the gloves, especially I'm gonna expose her private area, and you never know whether that area is wet with the body fluid. Okay, so try to prevent yourself. Universal precaution. Okay, Mrs. Smith, I'm gonna remove the blanket. Make sure she's covered. Okay. Now, can you turn to the side so that I can put the towel under you? Okay. Okay, make sure she's lying flat. Okay, Mrs. Smith, bend your knee, put your arm, and turn to your left side. Ready? 1, 2, 3. Very good. Make sure this catheter is not too tight for her to pull. Okay. And then 1 towel behind her. Okay, bring it back. Very good. And then 1 towel to cover her, and remove her gown from under the blanket so her gown is not going to be wet. And whenever you use water, make sure you ask patient to check the water temperature. Mrs. Smith, would you check the water temperature? Is it warm? Good. Okay. Okay. Now you wet the washcloth. Make a mitten. Okay. You put the soap on the mitten. Okay. Can you bend your knee and spread your leg a little bit? There you go. Okay. Okay, and then I'm going to clean your tubing, okay? And you open the top. Compared to the pericare, since you're not touching the patient, you need to hold the catheter, because while you clean it, you accidentally pull the tubing, okay? So you use finger to hold the tubing close to the meatus, but then you're not touching that part. Now you clean the tubing, 1 stroke, top to bottom, clean, and then the other side, clean. Okay, very good. And then you cover back. Now you rinse the towel, squeeze the water out, make the mitten again. Mrs. Smith, I'm going to rinse the tubing right this time, okay? You open, you hold the tubing again to stabilize. Okay, you clean from top to bottom, top the bottom away. Okay, and then now you can use the bottom towel to dry. Make sure you're holding the tubing, okay, one side and other side of the towel one side. Okay, you're not using the two same side. Okay, now put the patient's gown on top of the towel and you remove the towel from under the patient's gown. Mrs. Smith, can you bend your knee and turn to the side a little bit so that I can remove the towel from behind you? Okay, if patient can lift his bottom, ask patient to lift because you're only going to remove the towel. Okay, turn. Very good. And then you remove the towel. Very good. Make herself comfortable. Since your hand is touching the tube close to the peri area, in fact you didn't touch the patient, but you use one hand to just close the cover. Mrs. Smith, I'll be back and I'm going to make you comfortable, but I'm going to clean this equipment first, okay? And then I'll adjust the bed when I come back. Now wash my hand, okay? I'll be back. Side wear is up. You get your stuff clean. Okay, return the soap in the designated area and rest of the towel to the hamper. You rinse the container, okay, and you remove the gloves. You wash your hands, okay, at least 15 seconds, okay, you clean. Okay, now you come to your patient's room. Make sure everything's good. If anywhere is wet, you just kind of clean. Mrs. Smith, are you comfortable? Raise the head of the bed maybe a little bit so that she can watch the TV. Okay, here is your call light. If you need me, call me. Okay? Scan the room, everything's nice. Make sure Sadra is up and she's safe and she's comfortable. Okay? Come, open the curtain. You already washed your hand earlier, so you're done.